In this video, I will be demonstrating the anatomy and mechanics of the radiocarpal joint, commonly known as the wrist joint. I'll identify the articulating surfaces, discuss the structures and function, explain the available motion, and connect these to arthrokinematics and in our two prior course concepts. So for the proximal and distal articulation surfaces, here, I need you, supination, thank you. So the proximal, just forearm, and the distal radius with the articular discs are a part of the triangular fibrocartilage complex, or TFCC. The distal hand side is the scaphoid and lunate. This will be the distal hand side. And the triquetrum. The joint classification would be synovial ellipsoidal condyle joint, and the function type is diarthrotic, which is freely moving. For flexion, it is about 80 degrees, whereas extension will be about 70. This is looking more like 90. Very flexible wrist. But the average is usually about 70. The radial deviation, which is about 20. So I need you to move your wrist to your right. Just the wrist. No, like just the wrist. Yeah, well, okay. Oh. Yeah, I like that. Keep your palms flat. Yes, is about 20 degrees. And then the ulnar deviation is about 30 degrees, which is adduction versus adduction. Abduction versus adduction, yes. For flexion and extension planes and axes, that'll be a sagittal plane and the frontal axis, and the radial ulnar deviation is frontal plane and sagittal axis. So the proximal carpal row are convex, while the distal radius and articular disc are concave. During wrist flexion, convex carpal surfaces roll anteriorly, palmar, and side posteriorly, dorsal, versus wrist extension. Convex surface rolls posteriorly, which is dorsal, and side anteriorly, palmar. This side roll combination keeps the joint centrated and stable, preventing impingement or dislocation, and distributing pressure evenly across the joint. For the lever system, the wrist primarily acts as a third-class lever during flexion and extension. Fulcrum radial carpal joint. The effort is wrist flexor and extension muscles, and the load will be the weight in the hand. This lever favors speed and range of motion over force, which explains why the wrist moves quickly, but can be prone to overuse injuries. Okay, thank you. For the tension relationship, the wrist flexors, the flexor carpi radialis, flexor carpi ulnaris, and wrist extensors follow this principle. When the wrist is overflexed, so try flexing it without too much, don't hurt yourself though. Extensors are stretched, lengthened, and generate less active tension. But when the wrist is overextended, flexors are shortened, leading to active insufficiency and weaker grip strength. You can relax now. Thank you. That's why grip strength is maximal when the wrist is in slight extension. Optimal overlap of actin and myosin for peak force production. So as an example, I'm going to have you, thank you, and make a fist. And now try making a fist. Keep your fist, but flex your wrist. And squeeze as hard as you can. Yep, your wrist goes back to the extension versus flexion. So your wrist strength, or your grip strength is stronger when it is slightly flexed, which is also a great example for arm wrestling. So the radiocarpal joints ellipsoidal structure allows for complex multiplanar motion, while its roll, slide, kinematics, that's what it is, maintain stability. Understanding its lever mechanics and link tension relationships helps explain functional movement like gripping and lifting.